Okay, now we're going to move into the discussion portion of this session. I want to mention, and this should have been mentioned earlier, but forum members and speakers who are seated at the tables will have sort of the first crack at making comments or asking questions. And the way to be called on is to take your name card and stand it up so that I can see who's ready. This is what they do at the OECD meetings, by the way. It's the other place I've seen. It's very effective. So if you want to make a comment, stand up your name plate so that I can see it. Members of the audience who also would like to make comments after we hear from the forum members and speakers, if you'll line up at the microphones, and then I'll know that you're ready to ask a question or make a comment. So I'll open the floor up to, yes, Sheldon. Gosh.
Charlie, you mentioned very briefly about, for lack of a better term, simple intoxication, and how the system, whether it's the police or whatever, EMS, views that as a nuisance.
Okay, yeah.
What more do you think can be done as a point of early intervention relevant to basic intoxication?
In terms of policing it, I think a more active, so if police see it, first off, I think that it needs to be cited and treated as a nuisance activity and a nuisance crime. And most cities have laws on the books that allow police to do that, particularly public drunkenness or other disorderly conduct related to drinking. But I think the other thing is to the extent that urban environments can be changed to get residents to become better informal policers of that activity and getting them to call the police for these sorts of actions, or at least to say something and not be as tolerant of it, I think could go a long way. And we've done some work in Philadelphia, in Newark we're starting some work, in New Orleans we're starting some work of changing those urban environments to get residents to be more actively engaged in their neighborhoods. And what we notice when you do that is that residents suddenly call the police more for little acts of disorderly conduct, particularly public drunkenness, and that can change that environment quite a bit, because then you've taken the alcohol off the table and perhaps some of those individuals might be carrying a firearm at the time, and so that might actually reduce, and we've noticed that it does actually reduce firearm injury in those communities.
Nina.
Oh, okay, thank you. What do we know about the circumstances surrounding incidents where alcohol is a factor, either for perpetration or victimization? You know, as far as, you know, where are these incidents occurring? Are they more likely to happen in places, you know, that are serving or selling alcohol? You know, what's the, you know, connection with domestic violence? Is alcohol a greater factor in domestic violence, or, you know, in street violence? I mean, what does the research tell us about those questions?
So we've done a little bit of work and other studies comparing the environment of firearm suicide compared to the environment of firearm homicide. And what we find for firearm suicide is those are largely isolated events in isolated areas involving a single individual, right? Whereas firearm homicide are often in areas where there's much more traffic and more people around, and the event obviously involves at least two people, but might also have many other folks around at the same time. You know, when we looked at and visited, part of the study of alcohol outlets in the city of Philadelphia meant that we did field work, and we randomly chose almost 100 of these and went and visited them on Thursday, Friday, and Saturday nights around midnight, right? And to do observations. And I think some of what we noticed is, well, first off, in the off-premise outlets, they were the only very well-lit places, and otherwise quite in neighborhoods that had streetlights that were out, abandoned homes, so quite dark at night, these neighborhoods, except for the one well-lit corner alcohol distributor, where folks would come in, and again, they're supposed to be taking that home, but we watched frequently, folks would buy the alcohol and drink it right nearby. And if you go into these places, they are often, there's a lot of sign pollution in these places, banning violence, banning the possession of weapons, banning drug dealing, banning the sale of illegal videos, I don't know, whatever else. And many people who study alcohol outlets take that and have correlated that with actual violence, right? And I think that environment where there's a lot of foot traffic and a lot of activity, and we witnessed a few scuffles outside of these places, and there's the probability of street-based disagreements and arguments that then get exacerbated by the fact that people are consuming heavily, is a very challenging environment. And I would argue that it's different than an environment inside a building where there are servers and bartenders who, I agree, don't always control the situation, but there's more of an element of control than street-based drinking arguments and firearm possession.
Okay, Jeffrey.
I wanted to ask a question about a particular law. One of the slides Charlie showed indicated that there are 26 states that illegally restrict not only sale but possession of firearms from people who are intoxicated. And I'm wondering how those do or don't apply to situations such as people who are intoxicated in their own homes and have guns in their own homes. Or are we talking primarily about public intoxication? And you know, our group is doing this evaluation in 2 states of preemptive gun seizure laws, and this is a situation in Connecticut that we've heard about. For example, if somebody is intoxicated at home, a spouse can call police and say, you know, my husband is intoxicated and has these guns, and that is an occasion where, with a law like that, police could seize the firearms even if a crime has not been committed. But I'm wondering how that actually works, because what we know from Garen is a lot of people are intoxicated, a lot of people have guns, there's going to be a big overlap, and you know, so I just wanted to hear a little bit more about that.
And I think the addition to that is, and a lot of people might be at home while they're intoxicated
Right.
with their firearms, perhaps even more. You know, we worked with the University of Pennsylvania Law School on this, and I don't recall having gone through all those state laws at the time that any of them specified home location versus outdoor location. So I don't know that that's specified, but it's a really important question. I mean, being intoxicated with a firearm has equivalent risk at home or on the street, I suspect. And perhaps there are different and perhaps enhanced risks in the home where family is and other things, and where domestic violence or intimate partner violence might occur. So I think that's a really important question and worthy of follow-up.
Or suicides.
Oh, correct, yes, or the commission of suicide, which is much less a street event. It's much more, as I said before, a home and isolated individual event. So that's a great question.
Okay, Steve.
Thanks very much. Jim Mercy outlined global burden of homicide, suicide. We know there are reports of the global burden of alcohol-related illness and injury. In your background search, I know you mentioned that your comments are primarily U.S.-centric. Do we need much more work in other countries that have elevated rates of firearm-related homicides? Honduras comes to mind, Central America, and so forth. We really need a lot more information about those high rates and alcohol, that intersection. And maybe, Karen, you can also comment.
So I'm so glad you asked that question. I would say, well, first off, all the articles I looked at, oftentimes there wasn't a focus on the intersection of alcohol and firearms. First off, that was incidental. And I would say the minority, the large minority were outside of the U.S., that had been conducted outside the U.S. This despite, I wrote it down because I thought it was a very fascinating comment that Jim Mercy made, that homicide is the leading cause of years of potential life lost in Central America. So I work in Guatemala. We have a program in Guatemala funded by the NIH and the Fogarty International Center to train research scientists in the country. And I will tell you, Guatemala and Honduras and Belize and other places like that in Central America are woefully under-equipped in terms of their scientific capacity to study these issues. And Peggy and I were talking before that I think the NIH should be thinking about funding studies and scientists here, but building scientific capacity, particularly in developing nations, particularly in developing nations like in Central and South America that have very high levels of violence, to study and to act on that problem of violence. In Guatemala, it is their #1 problem. It is what they think about. If you talk to the leadership on up to the vice president and president of that country, it is the thing that they talk about. And in fact, the next thing they say after violence is our biggest problem. What can we do about the alcohol-related aspects of that violence? Because that's also a coterminous problem.
Okay, Garen.
I actually don't have anything to add to that. That was the whole story.
Lanny Berman, sorry.
Particularly with relevance to firearm suicide and alcohol, I wonder if you could talk a little bit about the quality of the data, given the infrequency of toxicology studies, and any efforts being made to improve upon that?
Yeah, I think historically, if you go back into the 70s and 80s, there are issues of testing. So the testing rates of who even got tested are probably in the 60 to 70%. I would say more recently, for many of the case series I looked at, those had grown dramatically. They were up in the 90s and exceeded, by the way, firearm homicide. Now, the few studies that we've done in the city of Philadelphia, there was a small percentage of people that didn't, in terms of the decedents, that didn't get tested for alcohol. I think none of the firearm suicides, or maybe a tiny fraction of a percentage, were not tested.
I was just going to add that, alcohol metabolizes quickly and at about a drink an hour. So by the time someone even, gets tested, a lot of the alcohol could be out of their system. We have made some breakthroughs recently, though, in better biomarkers, and we're hoping that those will be available soon, that you could even tell a few weeks later if someone was drinking heavily. And then we also can now look at light drinking within a couple of days. So that should really help the research a lot and also build the case. I want to say something about the reason why policy has to be done at the state level where alcohol is concerned. When the 21st Amendment ended prohibition in the United States, that constitutional amendment allows the states to set their laws about alcohol. So we can't do it at the federal level, except sometimes we can. If you notice, the drinking age, minimum drinking age in the United States is 21. Actually, every state has their choice. They can make it whatever age they would like. The reason they make it 21 is because of research that was done by Ralph Hinkson and others that showed those states that had it at 18 and 21, they showed the lives that were saved from drunk driving fatalities in the states where the minimum drinking age was 21. And even a states' rights president like Ronald Reagan saw what was happening when we showed the data. And what they've done is they've told states, if you want any federal highway funds, you have to have your minimum drinking age at least 21. So we've been able to coerce the states that way. We've done the same thing with little bit differently with the 0.08 alcohol limit, legal alcohol, blood alcohol limit. But so we have to be clever like that, but we still have to work at the state level because that's where alcohol laws are made. Okay, Evelyn.
What a perfect setup for my question, because I actually have a question about my state. Looking at the mapping of where there was no color on the map addressing sales or discharge or carrying, and it's living in Virginia and also as a West Virginian, having worked in domestic violence programs in both those states and anti-violence work. Both those states have ABC state-run liquor stores. So I'm looking again to the overview of this workshop, and we want to talk about policy and public health interventions, future research interventions. If you had the opportunity to speak to the governors of those states in which there needs to be intervention, what would be some of the recommendations or information that we'd like to give them?
I moved that question to the West Coast and thought about what I'd like to say to Jerry Brown. But what I would say, I think, to any governor is, because there's always pressure to answer the question, what's the one thing we ought to do? And if that question comes in the context of alcohol and firearm violence from a policymaker, given the evidence that we have, and you'll hear more of it this afternoon, I would say extend the prohibition criteria, the denial criteria for firearm purchase and access to include some, it's the equivalent of a per se law, some easily documentable marker of a history of alcohol abuse or dependence. Somebody has to undertake that policy experiment at some time.
Can I add to that? So if any of you have seen Ken Burns's Prohibition documentary, so prohibition of alcohol is not really an option. Many gun laws are quite challenging to pass, but I think no one, or almost no one, likes a drunk with a gun. And so I think that there are real opportunities here to at least tell the governors of the states that this is something that politically might be attempted and studied for its impacts. And I think there might be teeth in the ability to actually pass these things.
Just want to just briefly comment on Lanny Berman's observation about the data. In Wisconsin, we found quite a bit of variation on toxicology testing outside of metropolitan areas because the coroners don't have any money to do the toxicology testing. So I think there is a real important issue to, as NVDRS gets broadened and expanded, to look at those variations, given that suicide in rural areas is very, very common, and the coroner says, yep, it's a suicide, yep, I'm done, and doesn't do the toxicology testing because they don't have the resources to do it. So I think Lanny raised a very, very important point about that.
One of the things that you know, I think is important, most of my work is focused on the healthcare systems behind bars and really caring for people that return home from prison. And the last time I was here in 2012 at the Institute of Medicine, we convened a workshop looking at mass incarceration. And similarly, in that same theme of how we might prevent it. The U.S., as many of you know in the room, has kind of that same figure, which Dr. Wintemut has in his review, where the U.S. incarcerates more people than any country in the world. We have 1 in 100 behind bars, 1 in 30 under the purview of the criminal justice system, and it doesn't function. It doesn't function for public safety. It doesn't function for public health. And so, you know, in the spirit of thinking about preventing violence, I often think about how we can prevent incarceration. And so when I hear today and kind of the policies that are really thinking about policy remedies for thinking about the intersection of firearm violence and alcohol, much of my thoughts, you know, and especially ones that focus on policing and incarceration, many of my thoughts are about what are your thoughts, experts, of thinking about policies that then instead of sending them, locking them up behind bars and prisons and jails, how we might then think about, you know, if there are people that have alcohol misuse disorders, alcohol dependence, et cetera, how we can then bring them into the healthcare system instead of thinking about policing. So I wonder if there are policy interventions, current interventions that need of thinking about how we might prevent violence in concert with preventing incarceration. Because I think many times the policy remedies in one realm really conflict in another realm and do a disservice to our patients and our communities.
So I think that's a great question. And so I very much like the notion of preventing it before it even happens, preventing the event and preventing the occurrence of the event. So to the extent that alcohol, in this case, serves as the match that starts the event, if you can get people to stop drinking in the first place, there might be some real value here. And I'll go back to the environment of drinking, right? I think is a very important target for this. If there are opportunities, particularly to change the blighted and environments of our legacy cities in the U.S., including alcohol outlets, including specific types of alcohol outlets, that might be a real opportunity to go far upstream and change the occurrence of these in the first place. The other thing I'll add in terms of the medical system, although it has not been studied for firearm violence and victims of firearm violence, but brief interventions in the emergency department for alcohol misuse are important and have been shown to be quite useful in preventing recurrence of injury and violent events. So I think that that is something worthy of future study, especially for alcohol or gun violence.
A quick piggyback, obviously the strategies are complementary, they're not in conflict. Just as with harm reduction in other forms of substance abuse, work on prevention and at the same time try and uncouple the harmful behavior from the technology that makes it lethal.
Hi. Most of the work that I do is in Latin America and the Caribbean. Many times, one is sitting in front of a decision maker, either in a municipality or at a subnational level with a governor or at a national level. In light of the evidence that you have reviewed, many times with limited resources, et cetera, one is asked, well, what are the 2 or 3 key policies in regards to alcohol that you would want to promote in a particular country? Let's think about Latin America, just for the sake of this example. In light of the evidence, which would you say would be the most effective?
In light of Latin America, my experience in Central America in particular, and so thanks for the question, Andres, I think it's really good. I think that concerns about the environment and the environment, again, would come to play here. I think in our work in Guatemala, there's more information that's needed. I'll give you one example. There was no even recording of how many shootings there were in Guatemala City. No trauma registry whatsoever. And so they were even unclear of the magnitude of their problem until a few of the major hospitals decided to, with partnership from us and others in the US, decided to put that together. So even the discovery, at least in Guatemala for us, that the volume of these events, which might be as much as 10 times the US volume, for instance, was eye-opening. And then conversations can begin about what to do in that regard. I think the legal environment, there's not been enough study of it. I think there's been some very interesting opportunities for gun violence, broadly speaking. In Colombia, there's been some good studies of this. In Brazil, there's been some good studies of firearm laws and the impact that they've had on gun violence. But there's been very little study of policies in Latin America or outside the US in general in terms of alcohol and gun violence.
I would just say one of our former forum members was the mayor of Cali, Colombia. Rodrigo, somebody help me with. And he spoke often of setting the, dealing with alcohol in the city of Cali in terms of limiting hours of operation and licensing alcohol outlets made a big difference for that city in terms of violence. So you may want to talk with him about exactly some of the things he's, looks like you already know him. Bob Freeman is here. Robert Freeman directs our violence research portfolio at NIAAA. And I don't know, Bob, if you have anything you want to add in terms of which policies are most effective since, or which interventions are most effective since you've been managing that portfolio for a while. I'm sorry I'm putting you on the spot, but.
We've been trying for years to get intervention for sexual assault.
Talking about means of violence here, but I think that some of the interventions could be helpful, the interventions that we study in that area.
Well, I mean, if you look at the White House report on sexual assault on campus, they in the appendix, they talked a lot. They talked about land use zoning to decluster outlets around campuses. I mean, so I think, there's a growing body of evidence, as Charlie was pointing out. I mean, I think as you mentioned, Peggy, we have this announcement out from NIH calling for research, so we have 2 more years that is active, and that's the time to get in the proposals now, because we don't know what the environment is going to be like after that. So on this particular topic. I just had one question for Charlie. I was just wondering if the so-called smart gun development assesses whether the user is intoxicated.
I don't know the answer to that. I mean, I think they did that years ago with cars where you had to blow into something before you could use them.
Yeah, the interlock.
Perhaps Steve Terrett would know best an answer to that. I think it's a fascinating thought.
And here he comes.
None of the smart gun developers who are developing products that I've read about have tried to incorporate some kind of alcohol detection. I suppose it's technologically feasible to do it, although I would worry a little bit about people blowing into the barrel of a gun if they are intoxicated.
We do have new, yeah, I'm gonna, you're calling you next, but I just want to say we do have developing technologies that are improving our ability to test alcohol through skin and other very non-invasive ways. But was there somebody who had a point on this particular question? Oh, I'm sorry. I'm sorry. Yes, would the person at the microphone go next, and then we'll get yours. Okay.
I'm Ann Green. I'm here with two hats on, one as a member of a New Haven, Connecticut community resilience team, and also as a community research liaison for the Robert Wood Johnson Clinical Scholars Program at Yale. Thank you for doing this. I have a question out of curiosity. Has there been any research done on on-duty police officers' alcohol use and firearm use?
That is a brilliant question. We had something that we were thinking about in the past in terms of perhaps bringing police officers as part of a trial of alcohol use and their ability to then appropriately use their firearm. I mean, many law enforcement agencies consider their officers to be on duty all the time at some level, yeah, whether they're off the job or not, and their firearms remain with them. There are certainly questions about, not about so much for them, I think, in terms of banning their use of alcohol while in those off-duty periods, but about thinking about, just like we do with drunk driving. I mean, we didn't say you can't drink and drive. We said you can't drink to a level of intoxication and drive, and there might be consideration for police officers for these same things if we could establish what that level is. And I have to have a comment that shout out to my colleague at BU, Jonathan Howland, who's been thinking about doing this and has done these same sorts of occupational and alcohol usage experiments for things like maritime ship drivers and people driving cars. And also, this is one other thing that I mentioned in the paper that I think we should have consideration, not just active intoxication, but Jonathan's work has also gone into the day after, the quote, hangover effects of alcohol, and whether you can actually perform, for instance, with police officers, perform and use the weapon for the intent it was given to you even after having a night of binge drinking. Would that be possible?
Okay, we
Good
had
question.
one person who was waiting. We're going to have to end, but I'll let you go, and then we can talk during the break if you have additional things.
Thank you. It was actually most important to me that we had the opportunity to hear from Anne, as she most regularly asks brilliant and insightful questions like that. So inclusion of her voice was incredibly important. Thank you. Also, as I sit here with the team of community and academic partners that are investing in social connectedness in neighborhoods as a means of preventing violence, and somewhat in reference to what Emily, Dr. Wong, was mentioning earlier, and then after listening also to the Vaccine for Violence by Francis, read by Francis Henry this morning, I must say I take a little bit of pause at the discussion of exclusion, restriction, and punishment. And as we think about sort of how to balance that with really inclusion and investment, I would think about sort of what to do with the habitual drunkard or the perpetrator or disenfranchised neighborhoods. And I want us to think then about sort of What are policies and systems that exclude and punish and restrict due to the fabric of our communities? And how is it that as we sort of move forward in this conversation and we're considering sort of both of these ends of this sort of paradigm, how is it that we have that conversation and create the fabric within which sort of all of us can experience peaceful, thriving lives?
Once again, the alcohol discussion was lively, as it has been in other forums. Thanks you all very much for your contributions, and thanks to the panel.